Picking up where we left off, we're going to look at the thyroid gland. Thyroid gland is located inferior to the larynx. It has two lobes connected by an isthmus. The thyroid follicles produce thyroid hormones, thyroxine or tetraiodothyronine, which we abbreviate T4, and triiodothyronine, which we abbreviate as T3. Both increase your basal metabolic rate. They also stimulate protein synthesis, and it increases the use of glucose and fatty acids for ATP production. So if we take a look at that, both increases BMR, your basal metabolic rate, and what that is it's the very baseline of what you need to survive. So if you were sitting in a chair, not moving, how much energy would you need in order to do that? So that your basal metabolic rate, it's going to increase that. So if you have hypothyroidism, for instance, what's going to happen to your BMR? Well, it's going to go down. Okay, you're going to be more sluggish. You're probably not going to process glucose or fats as well. Okay, so with hypothyroidism, you tend to see weight gain. You tend to see low body temperatures. Okay, hair tends to be oilier. Okay, again, you're just more sluggish, no energy. Okay, now if there's more T3 and T4 than you should have, if you have hyperthyroidism, the opposite's going to be, you're going to have basically, I'm not sure about necessarily a higher temperature, but your activity is going to be higher, your heart rate tends to be a lot higher, you tend to be a lot more hyperactive, okay, typically a lot thinner. The eyes tend to look like they're enlarged and protruding a bit. We call that exophthalmos. Okay, and so there's quite a difference between the two. Okay, and all of that has to do with the levels of T3 and T4. And again, one of the things that regulates the amount of T3 and T4 is we go back to the anterior pituitary gland, and we have the TSH, the thyroid stimulating hormone. That can also regulate whether or not there's too little or too much or just the right amount of T3 and T4 produced. Then we have the parafollicular glands, or C cells, which produce calcitonin. And what calcitonin does is it lowers blood calcium by inhibiting bone resorption. So bone resorption, that's the breakdown of bone. So what the C cells really do is it lowers blood calcium by inhibiting osteoclasts. Remember, osteoclasts break down bone? Okay, if we inhibit those, we're going to have less bone resorption. And the less bone that gets broken down, then that's less calcium going into the bloodstream. And so if we look here, here's a right lobe, here's a left lobe, and then in between, connecting the two, is the isthmus. Okay. And here is thyroid gland. We're looking at it under the microscope. We have the follicle. Okay, so the whole thing is a follicle, which means the follicular cells are what surrounds it. So think about this three-dimensionally. This would be like a ball. Think of a ball, for instance. And what makes up the ball, like the rubber that makes up the ball, that's the follicular cells. And then there's going to be a follicle itself, or the follicular cavity, I should say. and that would be like the hollow inside of the ball. But if we fill that ball up with maybe some jello, okay, that would be like the thyroglobulin. Thyroglobulin is what we call a colloid. So what's a colloid? Have you ever taken like water? If you take water, put some dirt in it, shake it up. Okay, it's all cloudy. But if you let it sit for a while, all of that dirt settles out and you have clear water and dirt at the bottom. That is not a colloid. That's a suspension. What a colloid is something like mayonnaise or jello or I should say jelly, milk. All of those are colloids. The particles are in suspension, but they don't settle out. Okay? And so this thyroglobulin is a colloid. Okay? And then tucked in between there and there, possibly there, that's going to be the parafollicular cells or the C cells. Okay. So the control of thyroid hormone secretion. Thyrotropin releasing hormone, TRH, in the hypothalamus, that is going to tell the anterior pituitary gland to secrete thyroid stimulating hormone. And then situations that increase ATP demand also increase secretion of thyroid hormones. So with low blood levels of T3 and I think they messed this up here. Low blood levels of T3 and T4, I think that should be, or low metabolic rate stimulates the release of thyroid release hormone in the hypothalamus. Thyroid release hormone carried by the hypophyseal portal veins to the anterior pituitary stimulates the release of thyroid stimulating hormone by thyrotrophs. And again, when we talk about thyrotrophs or somatotrophs, those are the cells that are producing and making these hormones. So the thyroid stimulating hormone is released into the blood and it stimulates the thyroid follicular cells. And then T3 and T4 is released into the blood by follicular cells. Now, elevated T3 inhibits the release of TRH and TSH. And so that's where our negative feedback comes in. Now, if we take the thyroid gland out and we turn it around, we're going to find 4 little glands embedded in the thyroid gland, and those are called parathyroid glands. So they're embedded in the lobes of the thyroid gland. There's usually 4, 2 on each side, and it produces parathyroid hormone, or PTH, also called parathormone. Now, it's a major regulator of calcium, magnesium, and phosphate ions in the blood. It's going to increase the number and activity of osteoclasts. And it's going to elevate bone resorption. Remember the C cells in the thyroid? It lowered blood calcium levels. So it inhibit osteoclastic activity. Okay? In this case, we're going to increase the number and activity of the osteoclasts. We're going to elevate bone resorption, so we're going to have much higher levels of blood calcium levels at this point. Okay? So let's just go back for a second here. Here we go. So parafollicular cells, or C cells, produce calcitonin, which lowers blood calcium levels. And PTH is going to increase blood calcium levels. Okay, so they do the opposite of one another. And here we see, and we can see it just a little bit easier in the picture, where we have the parathyroid glands right there and there, there and there. Okay, we can kind of see them in this the cadaver picture here. A little difficult to see, but it's made up of these chief cells and these oxyphil cells. This is what we would see under the microscope. So again, the small ones are the chief cells. These larger ones are the oxyphil cells. Okay. And let's see. So what can happen if you get a tumor of these parathyroid glands? Well, think about that. If it starts secreting too much parathyroid hormone, then you're going to start to see really high levels of blood calcium. And that can be pretty dangerous because that can cause arrhythmias of the heart. It'll cause things like fasciculations, quiverings and stuff like that in the muscles. So, yeah, it's not a good thing. As a matter of fact, if you get enough bone resorption, you can start to develop osteoporosis. And we see that sometimes in young males, and their bones are going to look like postmenopausal females with the amount of osteoporosis going on there, or osteopenia, which is just thinning of the bone. Typically, osteopenia is normal as you age, but if you have osteopenia and you're young, then that could be a problem, and it might be due to maybe one of the tumors in the parathyroid glands. Now, luckily, you have 4 parathyroid glands, so they'll usually just remove the one, and you're good. Although I did have a student one year that their relative had 3 of the tumor, so they still had 1 parathyroid gland that was still in good shape. Now, back in the early days of surgery, there might be a thyroid tumor. They would remove the thyroid and then wonder why the patient suffered quite a bit and didn't quite make it through that procedure. And that's because they took the parathyroids along with it. And so blood calcium levels would basically drop, very low. And, that would be a problem with cardiac function and muscle function and all of that. So once they discovered the problem, what they can do now, if they have to remove a thyroid gland, is they can excise out the parathyroids, okay, and place them like in the fat area in the neck. And as long as it's got a nice cushy place to live with some blood vessels around it, it'll still do its job. It'll still produce the parathyroid hormone, the PTH. Okay. So the roles of calcitonin, parathyroid hormone, and calcitrol in calcium homeostasis. So if you have high levels of calcium in the blood, that's going to stimulate the thyroid gland, parafollicular cells, to release more calcitonin. The calcitonin inhibits osteoclasts, thus decreasing blood calcium levels. Low levels of calcium in the blood stimulates parathyroid chief cells to release more parathyroid hormone. Parathyroid hormone promotes the release of calcium from the bone extracellular matrix into the blood and slows the loss of calcium in the urine, thus increasing blood calcium levels. PTH also stimulates the kidneys to release calcitriol. And calcitriol stimulates increased absorption of calcium from foods, which increases blood calcium levels. So calcitriol, again, is from the kidneys. That increases blood calcium levels along with parathyroid hormone. Calcitonin lowers blood calcium levels. Now we're going to take a look at the adrenal glands. There's two structurally and functionally distinct regions. You have the adrenal cortex, which contains mineralocorticoids, which affect mineral homeostasis. And then glucocorticoids, of which cortisol is a glucocorticoid, affects glucose homeostasis. And then we have androgens, which have a masculinizing effect, and that is going to be DHEA or dehydroepiandrosterone, which is only important in females. And then the adrenal medulla is a modified sympathetic ganglia of the autonomic nervous system. It intensifies the sympathetic response, and here's where it produces epinephrine and norepinephrine. Epinephrine is what we typically call adrenaline. And here we see the adrenal glands sitting like little party hats on top of the kidneys. And again, we slice through it. We can see the adrenal cortex and the adrenal medulla. And then we're going to have all of these layers. Now, this layers could be on a test. We have the capsule on the outside. Then our adrenal cortex. We have the zona glomerulosa, which secretes the mineralocorticoids, mainly aldosterone. Then we have the zona fasciculata, then the zona reticularis, and then finally the adrenal medulla. And a good way to remember this, a good mnemonic, first of all, you need to know the capsule. But the mnemonic for remembering the adrenal cortex in order is you think of GFR. Later on, when we learn about the kidney, we'll talk about GFR as glomerular filtration rate. But in this case, GFR is going to be glomerulus, fasciculata, and reticularis. Okay? And as far as the hormones that these produce, think of ACT, A-C-T. So A is going to be aldosterone, C, cortisol, and T, testosterone. Okay, so GFR, ACT. Now looking at the pancreas is both endocrine and an exocrine gland. Now roughly 99% of the cells in the pancreas produce digestive enzymes. The part that we're looking at in the endocrine system is the pancreatic islets, or the islets of Langerhans. Now we have alpha or A cells, and that's going to secrete glucagon. Glucagon raises blood sugar. Basically, glucagon tells the liver to start breaking down glycogen, and glycogen gets broken down quickly into glucose, and so it raises blood sugar. Now the beta or B cells secrete insulin, and insulin lowers blood sugar. And it does that by inserting these transporter molecules into the cells that are called receptors, and that's capital G, L, U, capital T. So GLUT receptors, which stands for glucose transport receptors. And the more insulin there is, the more of these receptors get plugged into the cells to transport glucose into the cell through facilitated diffusion. And then we have delta or D cells, and this secretes somatostatin, which inhibits both insulin and glucagon. And so this is a way, think of about a teeter-totter or a seesaw. Okay, we're trying to keep it level. All right, if there's too much blood sugar, okay, tipping the teeter-totter or seesaw one way, then we're going to secrete more insulin. That's going to lower blood sugar. Throughout the day, as you utilize glucose to make ATP, well, to turn ADP into ATP, we're going to start to lower our blood glucose levels. Okay? And so as the blood glucose levels go down, then glucagon is secreted in order to break down the glycogen back into glucose and raise the blood sugar up. Okay? If the blood sugar is nice and stable, the somatostatin inhibits both insulin and glucagon to help maintain that nice stable level. Okay. And then F cells secrete pancreatic polypeptide, which inhibits somatostatin, gallbladder contraction, and also secretion of pancreatic digestive enzymes. And again, we see the pancreas here. Under the microscope, and typically I'll start off on a lower power, and I'll look for these lighter colored islands. And by the way, that's what islet stands for. That's what it means. It means island. So I look for these little islands, and then when I zoom in on them, then I can see the pancreatic islet, or the islet of Langerhans. Okay? And it's going to be made up of, you're going to see capillaries. Now surrounding it are these exocrine acini. These are what are making juices and such for the digestive function of the pancreas. Okay. Here we can see some alpha cells that secrete the glucagon. Here's the delta cells that secrete somatostatin. And the bulk here is going to be the beta cells, which secretes the insulin. Okay. Now, negative feedback regulation of glucagon and insulin. So low blood glucose or hypoglycemia stimulates alpha cells to secrete glucagon. Glucagon acts on the hepatocytes, the liver cells, to convert glycogen into glucose, and we call that glycogenolysis. And it forms glucose from lactic acid and certain amino acids, and that's going to be gluconeogenesis. In other words, producing glucose from non-glucose sources. So it's new glucose, gluconeogenesis. And then glucose is released by the hepatocytes, and it raises blood glucose levels to normal. If blood glucose continues to rise, hyperglycemia inhibits the release of glucagon. So high blood glucose, hyperglycemia, stimulates beta cells to secrete. And what it secretes is insulin. So insulin acts on various body cells to accelerate facilitated diffusion of glucose into the cells. It also speeds conversion of glucose into glycogen. And so that's what happens to the excess glycogen, or glucose, I should say, gets turned into glycogen. And then increase uptake of amino acids and increase protein synthesis. Also speeds synthesis of fatty acids, lipogenesis. And it slows glycogenolysis, and it slows gluconeogenesis. So, again, what does insulin do? Accelerates the movement of glucose out of the bloodstream and into cells. What's left over gets turned into glycogen, and what's left over after that gets turned into fat, basically. And so, as a result, blood glucose levels fall. And if blood glucose continues to fall, hypoglycemia inhibits the release of insulin. Okay, ovaries and testes. These are gonads, and they produce gametes and hormones. Ovaries produce two estrogens, estradiol and estrone, and it also produces progesterone. With follicle-stimulating hormone and luteinizing hormone, it regulates the menstrual cycle, helps to maintain pregnancy, and that's where progesterone comes in. Okay, think of that word. If we take it apart, progesterone, progestation. Okay, it's for gestation. It also prepares the mammary glands for lactation, and it maintains female secondary sex characteristics. Inhibin inhibits FSH, follicle-stimulating hormone. And then relaxin is produced during pregnancy, and what that does is it causes the ligaments to become a lot more elastic and allows for all that stretching and movement that's taking place as the baby develops. Now, I mentioned I was a chiropractic physician. I guess I still am. I just don't practice. But I remember the best patients that I had to treat were my pregnant patients. You know, they had, of course, back pain and everything. And so I treated that. I remember one patient who also had migraines, so her medical doctor suggested she see a chiropractor. And since I was treating a friend of hers for migraines, she came to me. And so she didn't have to take the migraine medication. But my pregnant patients, it was so easy to adjust them. All I had to do was pretty much get them in position, and before I could hardly even do the adjustment, they adjusted. Okay, it was great. And I remember my one patient that I was just talking about. I saw her from the time she found out she was pregnant all the way to she was on her way to the hospital. And I found a friend's office that was right off the highway. So they got off the highway. I adjusted her real quick. She got back on the road again. Said that was the most comfortable delivery she's ever had. But all thanks to relaxin. I wish I could give that to my more difficult patients. Anyway, so again, it's going to just make things stretch out, those ligaments more lax, so that it can accommodate for the new postural changes, and eventually for the pelvis to expand during the birthing process. And then the testes produce testosterone, and it regulates sperm production and maintains male secondary sex characteristics. And again, inhibin inhibits FSH, follicle stimulating hormone. The pineal gland, also called pineal body, is attached to the roof of the third ventricle of the brain at the midline. It's made up of masses of neuroglia and pinealocytes. Melatonin is an amine hormone derived from serotonin and appears to contribute to setting the biological clock. more melatonin is liberated during darkness than at daytime. And this is why a lot of times people will use melatonin to help with sleep. The thymus and other endocrine tissues. The thymus is located behind the sternum between the lungs, and typically the thymus is a lot smaller in adults than it is in children, so it does start to shrink as we get older. It produces thymosin, thymic humoral factor, thymic factor, and thymopoietin. And all of those are involved in T cell maturation. So remember we talked about our lymphocytes. The lymphocytes will turn into B lymphocytes or T lymphocytes. T lymphocytes are called T lymphocytes because they mature in the thymus. B lymphocytes mature in the bone marrow. But guess what? That's not why we call them B cells. We call B cells because we first discovered them in the bursa of chickens. And so that's why we call it B cells. But T cells, we do call it that because they do mature in the thymus. And just kind of a side story here about the thymus. Again, babies sometimes can have a huge thymus. Okay, kids tend to have a huge thymus. Well, back in the day, we're talking, I think, 50s, 60s, in that era, back in my day here, I think the theme was, don't worry, it'll grow back. If it doesn't, you probably didn't need it in the first place. Let's cut it out and see what happens, kind of thing. So these babies would have these large thymus, and it's like, ooh, nature can't be right. We're going to have to fix it. So what they did with these children was X-ray therapy, where they would hit them with high doses of X-rays to shrink the thymus, and it would shrink the thymus. But guess what the result was of that later? Okay, the result of that later was, of course, the children developed cancers, mostly lymphomas and leukemias. So I guess the takeaway is don't nuke your children. It's not good for them. Okay, so that was kind of a bad thing. Okay, not kind of a bad thing. It was a horrible thing. Okay, the stress response. Eustress is helpful stress. Distress is harmful stress. So when you see this where it says you, that means normal. You is normal. Okay, I'm not saying you is normal because I don't know you that well. You may not be normal. I'm not normal. But when you see this term right here, you, that means normal. Okay. Now the body's homeostatic mechanisms attempt to counteract stress. Stressful conditions can result in stress response or general adaptive syndrome, which we abbreviate as GAS. So what's the takeaway? I guess stress gives you gas. I don't know. Forget that. Anyway, but that's general adaptive syndrome. They could have come up with a better mnemonic, couldn't they, for that? Or a better abbreviation. Yikes. Anyway, there's 3 stages. There's the initial fight or flight. There's slower resistance reactions, and then eventually exhaustion. And prolonged exposure to cortisol can result in wasting of muscles, suppression of the immune system, ulcerations of the GI tract, and failure of pancreatic beta cells.